Welcome to Health Insights, and I'm your host, bringing you essential information about conditions that affect millions of people every day. Today, we're diving deep into a topic that touches nearly 80% of adults at some point in their lives: herniated discs. If you've ever experienced sudden back pain that seems to shoot down your leg, or if you're wondering whether that nagging discomfort in your spine could be something more serious, this episode is absolutely for you. A herniated disc might sound like complex medical jargon, but understanding what it is and how it feels can be the difference between getting proper treatment and suffering unnecessarily. So let's break this down in a way that makes perfect sense. First, let's talk about what a herniated disc actually is. Picture your spine as a stack of bones called vertebrae, and between each of these bones sits a soft, cushion-like structure called a disc. Think of these discs as nature's shock absorbers. They're incredibly clever little structures made up of a tough outer layer called the annulus fibrosus and a soft, gel-like center called the nucleus pulposus. Now here's where things get interesting. When we say a disc is herniated, we're describing what happens when that tough outer layer develops a crack or tear, allowing the soft inner material to push through. It's similar to what happens when you squeeze a jelly donut too hard and the filling starts to leak out. The difference is, when this happens in your spine, that leaked material can press against nearby nerves, and that's when the real problems begin. What's fascinating is that herniated discs can occur anywhere along your spine, but they're most common in two specific areas. The lower back, or lumbar spine, is the most frequent location, accounting for about 95% of all herniated discs. The neck area, or cervical spine, is the second most common spot. The middle back rarely experiences herniated discs because it's naturally more stable due to the ribcage structure. Now let's talk about what this actually feels like, because recognizing the symptoms is crucial for getting proper treatment. The experience of a herniated disc can vary dramatically from person to person. And here's why that matters. Some people might have a herniated disc and feel absolutely nothing. Yes, you heard that right. Studies show that many people have herniated discs visible on MRI scans, but experience zero symptoms because the disc material isn't pressing on any nerves. However, when symptoms do occur, they can be quite distinctive. The most common sensation is pain that starts in your back but doesn't stay there. Think about this. If you have a herniated disc in your lower back, you might feel sharp, shooting pain that travels down through your buttock and into your leg. This is called sciatica, and it follows the path of your sciatic nerve. The pain often feels electric or burning, and it can be accompanied by numbness, tingling, or even weakness in your leg or foot. For cervical herniated discs in the neck, the pattern is similar, but affects different areas. You might experience pain that radiates from your neck into your shoulder, arm, and sometimes all the way down to your fingers. Many patients describe it as feeling like someone is running electricity down their arm. Here's a key point that often surprises people. The location of your back pain doesn't always correspond to where the herniated disc is located. You might feel the most intense pain in your leg, but the actual problem is in your lower back. This happens because nerves can carry pain signals far from their source. What's particularly important to understand is how these symptoms can change throughout the day. Many people with herniated discs notice that their pain is worse in the morning when they first get up, often because the discs absorb fluid overnight and can put more pressure on nerves. Sitting for long periods, coughing, sneezing, or bending forward typically makes the pain worse, while walking or lying down often provides relief. Consider this. Herniated discs don't just happen overnight in most cases. They're usually the result of gradual wear and tear combined with a specific incident that becomes the final straw. Maybe you've been experiencing minor back stiffness for months, and then one day you bend over to pick up something relatively light, and suddenly you're hit with severe pain. That lifting incident didn't cause the herniation by itself. It was simply the trigger that pushed an already weakened disc over the edge. The good news is that understanding these patterns can help you take action early. If you're experiencing pain that shoots down your arm or leg, numbness or tingling in your extremities, or weakness in specific muscle groups, These are signs that warrant professional evaluation. Don't ignore symptoms that interfere with your daily activities or keep you awake at night. What I find most important to share with listeners is that herniated discs, while painful and disruptive, are highly treatable conditions. The majority of people with herniated discs recover completely with proper care, whether that's through physical therapy, targeted exercises, or other conservative treatments. Surgery is rarely the first option and is typically reserved for severe cases that don't respond to other treatments. The key is getting an accurate diagnosis and starting appropriate treatment early, before the condition has a chance to worsen or create additional complications. If you're experiencing symptoms that sound like what we've discussed today, don't wait for them to resolve on their own. Visit our website for more detailed information about herniated discs and treatment options, or contact a qualified healthcare provider who can properly evaluate your specific situation and guide you toward the relief you deserve.